want to welcome you all to this event. For the purpose of people don't know where we are at the University of Medical Sciences, Ondo City, Ondo State, Nigeria. Today we are having our Founders Day, and out of it is a medical outreach. Akin lọ́pọ̀lọpọ̀ fún pé a pè ní ẹ̀sìn wá sí báyìí. Ilé ìwé University of Medical Sciences òun ni ẹ wà tí a ti pè ní fún ètò ìwòsàn ọ̀fẹ́. Kí a tó bẹ̀rẹ̀, mo fẹ́ jẹ́ kí ẹ mọ ọ̀wọ́n tí ó wà níbí báyìí. Vice Chancellor kò sí ní around, àmọ́ èèyàn tí ó wá dúró ìdúró Vice Chancellor lé òun ni Professor Dúyìlẹ́wẹ̀. Akọ̀ọ́lé àtẹ̀wọ́. Lára àwọn tí ó tún darí ètò yìí léde ni Dr. Apalaba. Actually, Mrs. Akibodela. Pẹ̀lú wa tún ni Dr. Kate Ìgbafẹ́. Mrs. James. Pẹ̀lú Mr. Michael. Ẹ ká fún ọ ní àtẹ́wọ́. That is Mr. David from the Department of Security. We also have Dr. Bimi Sola Akiwande. Dr. Bimi Sola Akiwande, please show yourself. She is our ophthalmologist, our eye doctor. Most of the agenda is open prayer by the referee for the Vice Chancellor. That is Professor Dúyìlẹ́wẹ̀. A round of applause for her. Okay.
Bàbá wa àti Ọlọ́run, a dúpẹ́ fún àpéjọ àti ọjọ́ yìí. A dúpẹ́ gẹ́gẹ́ bí University of Medical Sciences tí ó wà lọ́wọ́ pé fún gbogbo èyí tó wà níbi àti tó wà tí ò níbi. A dúpẹ́ Ọlọ́run pèsè nínú yunifásítì torí Vice Chancellor wa Professor ó mú iṣẹ́ yìí ọ̀tún ó sì rí i pé òun ṣe ká máa kọ́ ọmọ nìkan nínú ilé ìwé nǹkan tí ará ìlú tó tún lè rí àǹfààní gbà nínú ilé ìwé àti pé ìrìnàjò bàbá wa gba ọpẹ́ wa. Àmín. A gbé ilé ìwé sí iwájú Ọlọ́run, iṣẹ́ wa máa lọ síwájú. Amen. Gbogbo ẹ̀yin tẹ́ wá lé ní àgbàdúrà ìwòsàn pípé ó wà fún yín. Àmín. Àwọn ọmọ ilé ìwé náà wọ́n kàwé ọdún lọ sópin báyìí à ń gbàdúrà gbogbo wa rí òpin ọdún. Àmín. Gbogbo àdáwọ́lé wa kó máa yọ sí rere. Àmín. Nípa agbára Jésù.
Connected.
Àmín.
Creating room to pursue excellence for research and we get to work to achieve the best in our sciences. Build a nation, change the world. Touching lives and making impact in our nation is our goal. Touching lives and making impact is how we will grow. United, giving us a better tomorrow. United, better health for a greater nation. Pathway to a healthy nation, frontiering medical innovation and a benchmark in health education. Step by step in one accord, touching lives and making impact in the nation is our goal. Touching lives and making impact is how we will go. United, giving us for a better tomorrow. United, better health for a greater nation.
I would like to call on the representative of the Vice Chancellor, that is the Professor Duileme, to give us his opening remarks. A round of applause for her as she steps in.
Thank you very much. Hello, everybody. I stand here this morning to kickstart the community health outreach on behalf of our dynamic Vice Chancellor, Professor Adesegun Fatusi. I want to welcome everybody to this community health outreach. Like I earlier said, the university is not just producing doctors or students in different science careers. We are also touching on lives. And we believe that by the time people that are here today, they will be examined with different diseases. We have eyes. The ophthalmologist is here to examine your eyes if you have problem. We have the dentist. If you have problem with your teeth, we have the dentist here. The mental health, in case the doctors are going to examine you. Then ENT, anybody àrùn tó bá ojú, imú, ọ̀tá, gbogbo ẹ̀mí ni mo máa yíyẹ̀ wò bí.
Àwọn ọmọ ilé-ìwé University of Medical Science wọ́n fẹ́ wá dá yín lárayá pẹ̀lú eré kékeré kan. Eré kékeré yìí, eré ìdárayá, pẹ̀lú eré ìdárayá yìí ó máa kọ́ wa ní ọ̀wọ̀ kọ̀ọ̀kan gẹ́gẹ́ bí a ṣe máa tọ́jú ìlera wa, tọ́jú ara wa.
This morning we want to make sure we have a full of how important it is to do regular checkups. Right now, I'll be calling on the drama team. Act 1.
Wọ́n ní pé eré ìdárayá yìí ó wà fún àwọn àgbàlagbà. Bí àgbàlagbà ṣe ìwúlò pé kí ẹ bá wá sí ilé ìwòsàn lójoojúmọ́ láti máa ṣe àyẹ̀wò ara yín.
Properly. So get back and start all over. So bend down. But people, where's your packer? Are you smart? So don't you useless a child? Sorry. Where are you going to start sweeping all over? Get back. Bend your back, bend your back. I'm going back now. How was it today? Okay, go and fetch of yourself. Come back here. Your place in the kitchen. Go and wash everything right now. Is this how you wash plates? Is this how you wash plates? Oh, you want to waste my soap. You want to finish my soap. You want to finish my soap. Next time you want to wash, you are going to go outside to go and wash. Come and continue washing them. Very useless a child. Stupid girl. You are wasting my money. You are wasting my soap. Are you okay? Useless child. I don't know my offense in this house. They are treating me too bad. They don't know what I did. I don't know, maybe because she's not my mother. I don't know what I did. Maybe I should take this thing and kill myself.
Sholape.
I'm just going to kill myself.
What are you doing?
I'm tired of
In your hand. You want to kill yourself?
I'm tired of all this thing that is happening to me. Because I don't know what I did bad.
Your tape money.
Yeah.
I will talk to her. But killing yourself is not the right thing. dreams to achieve. Right now, you need to see the
particular act was to show us the importance of it makes them become depressed, and in the end, many of them can end up killing themselves. So as parents, we are using this opportunity to inform us to take care of our children. You don't have to be hard on them to be able to tell them to do what they need to do. But as much as you are caring for your own health, also ensure you care for their own health. Thank you.
I'm having ear pain now. Let me go and complain to Daddy so that they can take me to the hospital. This pain is serious, so what am I going to do now? Daddy, I'm having ear pain. Yes. Daddy, I need to go to the hospital. My left ear is paining me. Daddy, Panadol is not for ear pain.
It's pain. Panadol.
When will it have used Panadol for ear pain? Panadol cannot do anything. I need to go to the hospital. Because I've already taken it now. It's not working. It's not working at all. This case has already. What am I going to do now? Daddy, I've taken the Panadol. It's not working. I need to go to the hospital. It's not working at all.
I'm very I don't like all this.
Daddy, I need to go to the hospital. The drug is not working.
Ashwepi.
I'm having ear pain. It's not working at all.
Can you hear me here?
No, I cannot hear you.
Can you hear me here? Hey,
I cannot
you
hear you.
stand up. Let's go to the hospital. Pele, stand up.
Just now. I think many of us can understand. Ishegu pain, teba feel you Panadol, Daddy as mommy. It's not when you have it's not every pain you feel that you should go and take Panadol. And when your children come with to you, so that they are feeling different things, hold them, bring them to yourself, and let them know what is wrong with them. Take them to the hospital. That is the second act we have.
Kì í ṣe gbogbo nǹkan tó bá ń ṣe wá ni a máa lo oògùn paracetamol fún. Wọ́n sọ fún wa wípé tí nǹkan bá ń ṣe yín, ẹ̀yin ẹ lọ sí ilé ìwòsàn, ẹ lọ bá dókítà yín, á fún yín ní oògùn tẹ́ máa lò. Nítorí wípé tí ó bá ti di pé tí wàá lo paracetamol yìí gan jù gan, ó lè tún lè fa nǹkan míì sí àgọ́ ara yín. Bẹ́ẹ̀ sì ni kò ní ṣe iṣẹ́ tó yẹ kó ṣe. Tí orí bá ń fọ yín, ẹ lọ sí ọ̀dọ̀ dókítà yín, á sọ nǹkan tẹ́ máa ṣe fún yín, á ṣọ̀wọ́n àyẹ̀fọ́ yín, á dẹ̀ jẹ́ kẹ́ mọ̀ nǹkan tí ẹ máa lò.
We have a lot to do on the farm today. Ajawa, are you listening? Shola? So everybody has to be at their duty post, and I want you to do it very, very well.
No problem.
So that we meet up targets. The yam tubers, please make sure you pack them together with your daughter. Ajawa, let's go to our own hand. We have to clear up all the, bushes and all that. It is well to get back to business. What kind of headache is this?
My husband, are you okay?
I have an headache and it's very strong. Please get me a go. Yes, a go will be good, A go will be good. Give me a go.
Are you sure this is
See, it has worked. I go always work. I told you. Let's get back to work. Ajao! My heart. Put your hand. It's panting. Can you hear it? Oh. I don't think it's hospital. It's just stress. I need to rest. I need to rest. I will be fine. You know I always get over these things. I will get over it. Yes. Let's go back to our works, Yeah, sure. My bro.
just before everything. This is the right. Smooth boy, everything smooth.
So you play.
Yeah, I don't.
Good afternoon, sir. Good afternoon, sir. Sir, you're supposed to sign. Sir, sir, you look sick. Alright, sir.
Why you sleep? What is it? No, they feel fine. That's true. What did they do? Oh, your body they pain you. Change the thing. No go hospital now. No one go. Why? That's more. Yeah, I'll call you.
Sir, help me, sir. Can I take you to the hospital?
I fainted. No, you want
Okay, wait, let me check your vital. How are you feeling now?
Complaining of headache and all of a sudden, you know.
What have you been taking? Don't you guys 53 millimole? What have you been taking? What have you been
Mr. Shemilore, what's it? You fainted. Okay. Please, how old are you, sir? What do you do?
I'm a banker.
Okay.
33 years old.
Okay. Mr. Shemilore, so what happened? What were you feeling before you fainted?
Body pain.
Sweating.
Oh. Tingling sensation.
Okay, when did all these symptoms start? Have you done anything about it since all of this started? Okay.
Sorry, Daddy.
And please, you said the blood sugar was 53 millimeters. Yes, ma'am. Okay. So, Mr. Shemilore, it's from these symptoms that we have come to find out, and from your blood sugar, it seems you have diabetes mellitus, and it's a chronic condition. Because you did not start managing it on time, there are already complications. That's why you're feeling those tingling sensations in your hands. That's why your body is weak, because you have not managed it on time. So we have to admit you immediately. Please get IV drugs and IV infusion as well, because we have to rehydrate this patient. So please, you have to make sure you are on your drugs and you are also taking your medicine. Please make sure you administer drugs. I'll come back and check on you in a few minutes.
Doctor, they just brought this patient. His blood pressure is very high, 221/70.
Okay, what's your name, sir?
Ajale Koko.
How old are you, sir?
He's
40 years old. Okay. Which work is
He's a farmer.
Okay, farmer. So what happened to him?
He was working on the farm. He kept complaining about headache. He took a dodo,
Okay.
and all of a sudden he fainted.
Any chest pain? Sorry, sir.
Have you been having
Any chest pain,
my dear?
No.
No chest pain. Sir. Do you drink? Do you take cigarettes? Okay. When did you start feeling all the symptoms?
2008.
So, sir, this blood pressure is high, and that will imply that you have hypertension. Yes, sir. It's a chronic condition. Calm down, sir. We'll take care of you. It's good you came to the hospital now. Let me tell you, Agbo is not the cure. It's not the cure for any condition. We'll take care of you here in the hospital. But all these small complications that you have started having, your eyes, can you see clearly?
So
So you're already having complications. So we'll take care of you. But please, you have to be faithful with your drugs
You have to be faithful also to your clinic visit. We'll admit you. Nurse City, please, we have to admit him. So take him to the ward and arrange drugs. I feel a better law and also cannula. Epelesa. Yes. I'll come back in the next 10 minutes to check on it. So make sure everything is put in place. When people don't take care of themselves, this is the issue.
Would you para Dubai?
No, sis, well done. Yes, ma'am. So what's the issue with the patient?
Ear pain. So I've checked her vitals and it was normal, but she's still complaining of ear pain.
What's your name?
My name is
Ini. How old are you?
okay. I'm 17 years old.
Okay. Ini, when did you start feeling this pain in your ear?
Last 3 weeks.
Last 3 weeks.
Yes.
So what did you do since that pain?
My daddy told me to use Panadol.
Panadol. Use Panadol.
Yeah.
So what have you put inside the ear now since you started? You put broomstick. That's an issue. I'll have to look into the ear to be sure the state of the ear. Just bend your head.
Hey!
So it's obvious something is inside that ear. We'll have to remove it. Don't worry, we'll do it in the hospital here today. We'll remove what is in the ear.
Yeah.
Oh, you are not hearing clearly with that ear.
Hey!
What of it? Do you feel pain right
Yes,
here in this
yes,
place?
yes.
Okay. Alright. So we'll do some tests, especially we'll take sample from that ear and we'll run a test. I'll write that out for you. And also you buy some drugs, antibiotics. But for that hearing, it's already getting complicated. I'm sorry, it may not be restored. But we'll do everything we can so that we can manage the condition where it's at now. So I'll write the drugs now. Make sure that you get all these things done by your next visit. So see me in 2 weeks. In Nigeria today, people decide to take care of themselves. They prefer to carry out self-medication. They prefer to use Panadol for every form of the sickness or feeling that they have in their bodies, and they end up with complications. 3 patients that have been seen today, and all of them have come down with complications because they did not take care of themselves on time. So this is us encouraging you to take care of yourself. Your health is your responsibility. Make sure you eat healthy. Make sure that you are eating the right food at the right time. Make sure you are exercising, and make sure you are going for frequent hospital checkups. The recommended checkups is that if you are less than 50 years old, you visit the hospital at least once in 3 years to get your vitals checked and be sure that you are in good health. If you are more than 50 years old, at least once in a year, make sure you visit the hospital and you get your vitals checked as well. And for any of you that have been diagnosed with any chronic health condition like hypertension, like diabetes mellitus, sickle cell anemia, or any other chronic condition, make sure you are visiting the hospital every time, as often as your doctor tells you to visit, because there are complications that can arise. Don't you think that is better that you spend small money, maybe some thousands of naira, to do checkup, than for you to now spend hundreds of thousands of naira when you are admitted in the hospital? I just want us to remember that our health is our responsibility. It's better to be in good health so that we can take care of our family and we can reap the fruit of our labor. Remember that health is wealth. Thank you.
On Dr. Gbemisola Akiwumi to talk to our health care. Dr. Gbemisola.
Mama, everybody. Dr. Akiwande, Dr. Olujumi. So lately, major thing that was shape, àwa yẹ ẹ̀yin ojú wa wò ká lè mọ àwọn tó ní àìsàn ayọ́kẹ́ fọ́jú. Kí dẹ̀ ni àìsàn ayọ́kẹ́lẹ́ fọ́jú? Bí orúkọ ẹ̀ ṣe rí náà ni ó máa yọ́ kẹ́lẹ́kẹ́lẹ́kẹ́lẹ́ títí tí ojú yẹn á fi fọ́. Ní òyìnbó a máa ń pè ní silent thief of sight. Ó wọ́pọ̀ nínú ènìyàn dúdú. Òun ló ṣe pàtàkì láti ìgbà dé ìgbà ká máa yẹ ojú wa wò. àìsàn wo ló ń jẹ́ ayọ́kẹ́lẹ́ fọ́jú? Mo ti ṣàlàyé nípa bí orúkọ ẹ̀ ṣe rí. À ń rí nínú ènìyàn dúdú, à ń rí nínú àwọn tó bá ti ń dàgbà. Téèyàn bá ti ń pé 40, 50, 60, ó ṣeé ṣe kí àìsàn yìí kó ni. Nǹkan tó tún ṣe pàtàkì ni pé ó máa ń wà nínú ẹbí. Tórí bàbá bá ti ní àbí ìyá, ní ọ̀pọ̀ ìgbà àwọn ọmọ máa ní. Nípa tí ó wà nínú èèyàn dúdú, ó ṣòro láti tọ́jú nínú ènìyàn dúdú. Àti ènìyàn dúdú bíi 10 bá ní, téèyàn aláwọ̀ funfun bíi 10 bá ní, ènìyàn dúdú tá fọ́ lójú ó máa tó bíi 6. Ènìyàn aláwọ̀ funfun bóyá èèyàn kan àbí 2. But bí a ṣe ń ṣe kó má fọ́ wa lójú ni ká gba ìtọ́jú. Tí èèyàn ò bá gba ìtọ́jú ni ayọ́kẹ́lẹ́ fọ́jú tó lè pọ̀ náà lójú. Ànìkan tí ó fi ṣe pàtàkì ká máa yẹ ojú wa wò ní ẹ̀ẹ̀kan lọ́dún. Tá bá ti pé ọmọ 40 ọdún, once in a year ó yẹ ká máa wo ojú wa. Tẹ́ tó bá jẹ́ ẹni tó jẹ́ pé bàbá àbí ìyá fọ́ lójú, àwa ò tiẹ̀ ní dúró di 40 ọdún tiwa, a gbọ́dọ̀ máa wá. Ìgbà míì á ní ó dàbí pé ní àìsàn ayọ́kẹ́lẹ́ fọ́jú, ṣùgbọ́n a lè sọ ní pàtó. Ó ní ayọ́kẹ́lẹ́ fọ́jú, kò kí ń ròyàn, kò kí ń dùnyàn, kò ní tàyàn, kò ní pọ́n, ṣùgbọ́n ayọ́kẹ́lẹ́ fọ́jú wà fún. Ó dìgbà tí dókítà olójú bá wọnú ojú wa ó tó sọ fún wa ó wà, because iṣan tó ń gbé ìríran lọ sí ọpọlọ, ibẹ̀ láìsàn yẹn ń bájà. Àdẹ̀lẹ̀ rí pẹ̀lú ojú lásán, iná tá a máa tàn sí wa lójú níbí òun la fi ń rí. Ó ní bẹ́yìn ojú yẹn ṣe máa rí tá a máa mọ̀ pé ayọ́kẹ́lẹ́ fọ́jú wà fẹ́. Àwọn nǹkan wo la ti rí tó ń fà á? Ní ọ̀pọ̀ ìgbà omi ojú máa ń ga, ìyẹn tá à ń pè ní intraocular pressure. Dókítà olóyún yí ojú pa, ó dẹ̀ máa pa, á dẹ̀ fa ìfọ́jú. Ìfọ́jú tó dẹ̀ máa ń ti ayọ́kẹ́lẹ́ fọ́jú wá ní àtúnṣe is the commonest cause of irreversible blindness. Kò ṣe é reverse, that's the unfortunate thing. Àwa gẹ́gẹ́ bí dókítà pé fẹ́ni tó bá wà ní ẹbí àbí tó ní ayọ́kẹ́lẹ́ fọ́jú, a lè ní kéèyàn má ní ayọ́kẹ́lẹ́ fọ́jú, bọ̀ a lè ṣe kéèyàn má fọ́ lójú láti àìsàn ayọ́kẹ́lẹ́ fọ́jú. Àwọn díẹ̀ dẹ̀ tún wà, omi ojú wọn ò ní ga, omi ojú between 10 and 21 yẹn ló máa ní, ṣùgbọ́n fún ojú wọn ó pọ̀ jù, ó dẹ̀ máa fa ayọ́kẹ́lẹ́ fọ́jú. Ó bá ní nǹkan tí a kọ́ níbí ilé ni pé ní alákọ̀ọ́kọ́ tá bá tiẹ̀ yẹ ibi tá a bá lọ, ọ̀pọ̀ dókítà, ọ̀pọ̀ èèyàn ló máa pera wọn ní dókítà olójú. Oríṣiríṣi wa ló wà. Àwọn kan wà wọ́n ń gé ìgò, àwọn kan wà wọ́n lè ṣe tẹ́ẹ̀sì kéèyàn lògò, wọ́n dẹ̀ lè tọ́jú àìsàn wẹ́wẹ́wẹ́. Àwọn kan wà wọ́n á tọ́jú gbogbo àìsàn tó ń ṣe ojú, wọ́n dẹ̀ tún ṣe iṣẹ́ abẹ. Ibi tá a bá lọ ó gbọ́dọ̀ dá wa lójú pé dókítà gidi ni tó lè wọnú ojú wa. Téèyàn bá ń lo glasses, ó lóye ọdún tá a gbọ́dọ̀ máa pààrọ̀ glasses o. Bọ̀tá bá lọ bí oríran dáadáa èèyàn fún wa nígò wa lò ó, lẹ́yìn oṣù 2 a tún lọ bẹ̀, ó tún ní ìgò ni. Lẹ́yìn oṣù 3 a tún lọ bẹ̀, ó tún ní ìgò ni. Ẹ jẹ́ a ṣọ́ra o, ayọ́kẹ́lẹ́ fọ́jú ti ń gba ìríran lọ. Téèyàn bá dẹ̀ wá dọ́dọ̀ dókítà tó lè tọ́jú ẹ̀, tó bá ti fọ́ ó ti fọ́ náà ni, kò sí nǹkan tá a lè ṣe. So àwọn nǹkan díẹ̀ tá a mọ̀ pé ó ń fa wàhálà nìyẹn. Tí ẹni tó ní ayọ́kẹ́lẹ́ fọ́jú kan bá ti rí pé òun ò ríran dáadáa, 90% tí ojú yẹn ti lọ. Torí á wà ń bẹ̀ fún ọ̀pọ̀ ọdún, èèyàn yá dẹ̀ máa ríran. Ìríran tó máa ń kọ́kọ́ ní ìríran ẹ̀gbẹ̀gbẹ́. Ìwọ̀nba èèyàn ló lè ṣàkíyèsí pé mi ò rẹ́gbẹ́. Ṣé mo pé bí mo ṣe ń wọ ọkàn lọ báyìí, mo sì lè rí kánópì débí, mo dẹ̀ sì lè rí kánópì débí. Wọ́n tí ayọ́kẹ́lẹ́ fọ́jú bá bẹ̀rẹ̀, ẹ̀gbẹ́ láti máa bẹ̀rẹ̀, a máa rí àárín dáadáa. Ìwọ̀nba èèyàn ló mọ̀ pé mi ò máa rẹ́gbẹ́ tó, òun ló fi ṣe pàtàkì ká máa yẹ ojú wa wò. So mo rò pé in a little way mo ti jẹ́ ká mọ̀ nǹkan tó ń jẹ́ ayọ́kẹ́lẹ́ fọ́jú, mo ti jẹ́ ká mọ̀ pé kò sí bá a ṣe máa mọ̀ tó bá wà ń bẹ̀. Ẹni tó bá mọ̀ 90% ìríran ti lọ. Nǹkan pàtàkì kí mo dẹ̀ wá kọ́ wa ni pé lẹ́ẹ̀kọ̀ọ̀kan ẹ̀ẹ̀kan lọ́dún ká máa lọ ọ̀dọ̀ dókítà olójú gidi kó wo ojú wa o. Tó bá wà ń bẹ̀, tá a bá tètè bẹ̀rẹ̀ ìtọ́jú ní ojú òní fọ́. Kí ni ẹni ìtọ́jú ẹ̀? Oògùn la máa ń lò ní ọ̀pọ̀ ìgbà. Eye drop ní ẹ̀ẹ̀kọ̀ọ̀kan tablet. Ẹni tá a bá rí pé oògùn ò ṣiṣẹ́ tó àbí oògùn gbòdì lára ẹ̀, a ní kó ṣe iṣẹ́ abẹ. Gbogbo ẹ̀ náà kò dá ìríran padà. Omi tí mo ló ń ga yìí ló máa mú wálẹ̀ sọ́dà kò ní máa fún iṣan ojú pamọ́. I think by and large, ọ̀kan tó ń jẹ́ glaucoma, and I hope this information helps. Ṣé yàn kankan ní ìbéèrè?
Lọ́wọ́ dọ́kítọ̀ wa, mo fẹ́ bèrè pé àìsàn ayọ́kẹ́lẹ́ fọ́jú rẹ̀ tó yàtọ̀ sí ìdánwò tó máa wà ní ojú rẹ̀ cataract.
Ayọ́kẹ́lẹ́ fọ́jú yàtọ̀, méjèèjì wọ́pọ̀ nínú ẹni tó dàgbà. Cataract ni mi ò mọ̀ bí màá ṣe sọ, òun ló máa ń fà á jù, reason téèyàn ò fi ríran, commonest cause of blindness. Ṣùgbọ́n ìyàtọ̀ tí ẹ ní pé tá a bá ti yọ kúrò èèyàn ríran padà. Wà á yọ́kẹ́lẹ́ fọ́jú tó bá ti gba ìríran lọ kò ní àtúnṣe.
Mo ti lo glasses nígbà tí mo ṣe sísí mi ò rí nígbà yẹn mo rí nǹkan tó súnmọ́ mi dáadáa bọ̀ mi ò rí ọ̀kan tí ilẹ̀ bá ṣú kán bá kan rántí mi lójú mi ò rí ọ̀kan nígbà tí wọ́n gba glasses fún tí mo ń lo yeast ló gbogbo ẹ̀ ó lọ mo drop glasses then nígbà tí mo tún wá over 60 almost 70 now mo wá rí pé nǹkan tó ṣe mí láyé sí mi mo tún wá padà mo kó glasses mi ọjọ́ yẹn mo kó wá ẹ ṣe.
Omi ní ìdí glasses àti ríran, tó bá dẹ̀ lo glasses àríran, ìyẹn ò ń ṣe àìsàn yẹn, àìsàn pé ojú yìí ò ríran dáadáa, ìgò àrùn lọ́wọ́. Téèyàn bá dẹ̀ ti pé 40 ọdún, bọ́lọ́run ṣe dá ojú wa, a ní ìdí ìgò láti kàwé. Ẹni tí ò bá lògò láti kàwé, tá a bá wò ó dáadáa, ẹni yẹn gan nìkan ṣe ojú ẹ̀, ìyẹn lọ́tọ̀. But tá a bá ń lọ hospital once in a year, wọ́n wojú wa ní o. Téèyàn bá ti tètè mọ̀ pé àìsàn wà lójú tó gba ìtọ́jú, kò ní burú ju eléyìí tí ò ní àtúnṣe.
Show bí a ṣe ń ṣe ìtọ́jú ara wa gan. Ẹlòmíì á clean, á fine, but tó bá sọ̀rọ̀, àwọn èèyàn fẹ́ gbọ́ tó bá sọ̀rọ̀ bọ́lá máa rùn. Ọkọ̀ kẹ́yìn yẹn dọ̀tí, á dẹ̀ wà bẹ́ẹ̀, kò dẹ̀ ní ṣe kankan sí. Ó ní àwọn ìtọ́jú ta lè ṣe tá a jẹ́ kí ẹyin wa better. And again, ṣe rí àwọn àìsàn eyín wọn lágbára gan. Fún ọ̀tá eyín bá múyàn ní alẹ́ bí ẹwọn fẹ́ sùn bí ẹyin wá bẹ̀rẹ̀ sí dùn ó lákòókò orí àmàdù gan-an ìjà àárọ̀ ọjọ́ kejì. And ìrora yẹn is bad, ìrora yẹn ó bad gan because o lè mú mọ́ra. And tó bá wá lẹ́nu tó bá lọ lọ́la kò mí ìpò ti lọ tán o ó sì máa padà wá ó kàn ń bá ẹ ṣeré ni ọ tó máa fi deal with that person ó lè jẹ́ meeting party láṣẹ̀ṣẹ̀ wá gbé wà láti ẹ̀dẹ́ and ìrora eyín ẹ̀ lè mú mára tó bá rí nǹkan mọ̀ pé eyín ti dùn ní ojú yín náà á pọ́n wá ni and again ẹ̀yin lè sọ̀rọ̀ dáadáa and ṣẹ́rí orí fọ́ tó tíyàn máa nígbà tí ẹyin bá ń dùn yàn yẹn orí fọ́ yẹn is not small thing àti rí àgbàlagbà rí jẹ́ pé kó di pa sí ilé ìwòsàn láàárọ̀ kùtù láti bá ń bẹ̀ tó ń sun ẹkún àgbààgbà 70-80 years old táwọn máa sun ẹkún wọ́pẹ́ ìfá àlè bẹ̀ wọ́n pé ẹjọ́ sẹ́ẹ̀ má sunkún mọ́ because the pain is very very serious ó máa ń pa èèyàn what you don't know can kill you sometimes.
lẹ́yìn ní 20 minutes ẹ padà wá àti ìfẹ́ ẹ wò ok sorry ẹ padà ẹ kì í ṣe ilé rẹ̀ yẹn.
Kí ló kọ yín? Breast kìdá.
So do you have any complaint like your wife feeling anything feeling?
dárúkọ yín mà. Ọmọkẹ́ Babájídé. Ní èní a wà ní Odòṣídà ní Unimed ní Odòṣídà fún ìlera ọ̀fẹ́ fún ètò ìlera ọ̀fẹ́. A dẹ̀ rí pé wọ́n ti ṣe etí yín wọ́n ti wọ̀nà fún ẹtì wo gbogbo ẹ̀. So mo wá bẹ̀ bí pé kí ni ẹ rí ètò tèmi sí.
Ètò tèmi yìí dáa gan-an. Ó dáa gbogbo wa la lọ́ọ̀ gbogbo wọn ṣe àtẹ́ǹsì wa gbogbo nǹkan tó ṣe wá gbogbo wọn rí jáde irọ́ ń bẹ̀ gbogbo nǹkan tó ń ṣe fún wa gbogbo ẹja ó ní wọ́n ṣe àtẹ́ǹsì wa dáadáa wọ́n tọ́jú wa dáadáa gbogbo ìfúnpá ni everything gbogbo tó ń wò gbogbo ẹ̀ ló dáa gbogbo ẹ̀ ló dẹ̀ ló wà láìsí ibẹ̀.
Ẹ ṣe àdúpẹ́ mà kí ni ìmọ̀ràn tí ẹ lè fún àwọn aráàlú nípa ìlera?
Ìmọ̀ràn tí mo lè fún àwọn ará ìlú nípa ìlera ni pé ká gbogbo bí tó bá ti ń pè fún ètò ìlera ó wù mí kí àwọn aráàlú wọ́n jáde ká wá gba ètò ìlera yẹn lóríṣiríṣi ká wá gba gbogbo ẹ̀kọ́ tó bá fún wa ká tẹ̀lé gbogbo ìmọ̀ràn tó bá fún wa then ká dẹ̀ gbárùkù gbogbo nǹkan tó bá ní ká máa ṣe ní ìlú ká má máa sọ pé irọ́ ni wọ́n pa kó má sí àwọn ìdọ̀tí kankan tó wà lójú ọ̀nà ọ̀kan tó bá fẹ́ ṣe fún wa.
Ẹ ṣe àdúpẹ́ mà ìbéèrè tí mo tún fẹ́ bi yín ni pé mo fẹ́ kẹ́ bá wa sọ nǹkan tó yà yín lẹ́nu tẹ́ ẹ rí ní èní nípa ètò ìlera.
Nǹkan tó yà mí lẹ́nu tí mo rí nípa ètò ìlera lénìí ni wípé irú etí tó ti ń yọ mí lẹ́nu for the past year mo rí pé ńgbà tí mo débi tó ń wo etí yẹn wò wọ́n dẹ̀ bá mi fọ̀ ọ́ torí pé wọ́n yọ ìdọ̀tí tán rí níbẹ̀ bí kòkòrò wọ́n rí bẹ̀ wọ́n bá mi yọ ńgbà tán fọ̀ ọ́ aládẹ̀ tì í rẹ̀ sí kankan tó ṣe ìbẹ̀ gbọ́rọ̀ dáadáa kankan yàtọ̀ sí gbogbo ìwà
ṣe àdúpẹ́ mà.
ọ̀rọ̀ yanjú tí mo lè gbà ni wípé ká tẹ́túbọ̀ párùkù ti iṣẹ́ yìí kó túbọ̀ máa gbòòrò báwọn aṣáájú ṣe ṣe tó fi dáa tí òfin ní ẹ̀rọ kí àwọn tó bá wà bẹ́ẹ̀ sí káwọn náà tún ṣe bí tàwọn tàṣíájú kí iṣẹ́ yẹn túbọ̀ lè máa gbòòrò Ọlọ́run Olódùmarè á túbọ̀ máa ràn yín lọ́wọ́ ẹ ní ṣubú dànù lórúkọ Jésù ẹ dẹ̀ ní ṣiṣẹ́ gbà lórúkọ Jésù.
àṣìgọ̀ rọ̀bọ̀ sí. Wọ́n kàn sí èmi bá wá sí bí àyẹ̀wò tí lèmi torí ẹ̀ wá. Mo dẹ̀ ń rí i pé wọ́n ń ṣe bó ṣe yẹ. Àwọn tó wà lórí ètò yẹn tó yẹ pé àwọn ló di ètò yẹn mú tó ń ṣe ètò yẹn fún àwọn tó ń wá láti ìta torí mi ò tiẹ̀ gbọ́ tẹ́lẹ̀ wọ́n á bá mi nílé tí wọ́n á sọ fún mi pé bàbá ń bolo wà wọ́n kọ́ báyìí máa ń lọ ní Unimedi tó bá rí bẹ́ẹ̀ tó wáyé pé wọ́n ń ṣe bó ṣe yẹ wọn ò ní wá bá mi nílé kán wá pè mí wọ́n wá pè mí ni wọ́n á bá mi nísìnyí mo lè wọ ṣòkòtò kémi sábọ̀ kémi gan lè rí tèmi.
Hello, B. Don't complain. Hi, thank you. I'm here already. I forgot to tell you. I'm back to all the that's it.
worship, to be honest. You're both
We appreciate you all for coming around for this program. We thank God for the success of this program.
You're fine.
We are happy you have learned a lot. You were around when our students gave the drama, and it was quite educative. We also listened to the ophthalmologist when she gave the talk, the ear doctor, the dentist, the physiotherapist, and then you participated in all that have done the screening, the care, the syringing, the dentist work, and everything. So we are all grateful to God for such a wonderful and successful outreach. So, by this time next year, we invite you again for another outreach in a bigger way. So we are really grateful to God and to you all for coming around, for making yourself available for this screening and this outreach. Thank you, everyone. Thank you, thank you, thank you, thank you, thank you. Great Unimed!